influenza is spreading rapidly in our area. New data showing the number of flu cases are 3 times higher than they were at this time last year.
WR's Ashley Rowe is in our studio. And Ashley, emergency department visits and hospitalizations from these respiratory viruses are also up.
This data, guys, is important to see, particularly given how people are getting ready to gather for the Christmas holiday. Doctors tonight saying the flu has peaked exponentially.
The hustle and bustle of the season is upon us. This time of year, many of us fighting crowds and the rising threat of respiratory viruses. New numbers from the state health department show more people are getting sick with the flu, RSV, and COVID.
Flu has exponentially peaked in the past 2 to 3 weeks, and we are currently in I would say, peaking right now.
Follow the yellow line on this chart showing how flu cases have gone way up over the past few weeks, sitting 3 times higher than this time last year. Just in the past week, 8 more people have died in North Carolina from the flu. That's a total of 22 deaths in the state so far this flu season. The percentage of people going into ERs with respiratory illnesses, the highest it's been in over a year.
All the children's hospitals are full, and a lot of that has to do with both RSV and flu kind of coinciding.
Pediatric emergency physician Dr. Dan Park offering a primary symptom to watch for in children.
If you are worried about your child's breathing, so the rate of breathing, the character of the breathing, and not breathing normally, they need to seek attention.
Doctors also say be smart this season. They recommend staying away from others for 24 hours after a fever breaks to protect others.
I want to show you another look at this state data also showing COVID cases. You look at this pink line, it indicates that the numbers are high as we get to this time of year, but they are lower than this time last year. COVID hospitalizations up just slightly from last week, Gerald.
We'll take away any positives we can get.
Yep.
Thank you, Ashley.